Using broad-spectrum antibiotics in poultry can help treat a wide range of bacterial infections, including respiratory, intestinal, and systemic diseases. However, they must be used responsibly to prevent antibiotic resistance and ensure meat and egg safety. Now, the essence of this video is to give you some medication or some drugs that act as broad spectrum. What we mean broad spectrum antibiotics is that they are able to control both gram-positive and gram-negative bacteria. So you don't need to spend money on a specific antibiotics. Instead, you get these broad spectrum antibiotics, and in most cases, these antibiotics are used when you are not sure of the particular disease-causing organisms. Please, if this is your first time of coming across my YouTube channel, kindly help me to grow my channel by clicking the subscribe button and turn on the bell icon so you get notified anytime I upload a new video. Don't forget to give this video a like, comment, and share for others to benefit. Like I said earlier, broad spectrum antibiotics, they are very good and they are very effective for control of disease outbreak on the farm. In most cases, you know that poultry or birds generally, they don't have mouths to speak, and in most cases we are able to tell the causes of the sickness or the infection by merely looking at the droppings of the birds or the physical appearance or the way the bird is acting. So we are able to deduce the causes of this disease, and in most cases a lot of these diseases are caused by bacterial infection, and these bacterial infection are of gram-positive and gram-negative. So the essence of this broad spectrum antibiotics is that when you are not sure of the particular disease that is causing it, be it gram-positive or gram-negative, by the time you administer these broad spectrum antibiotics, it will fight these diseases. That is the essence of this video. Now, I'm going to list some broad spectrum antibiotics for you and the work that they do specifically. So ensure to follow through. The first broad spectrum antibiotics is tylosin. You see this tylosin, it covers all those or it helps to fight against diseases such as the mycoplasma, the CROD, which is chronic respiratory disease, and any other respiratory infections. And this tylosin is just like the active ingredients, and some of the brands that you can get it from is Tylodox, Tylovet, or Tylan. This medication is water soluble and is very useful for control of CROD or synovitis or any kind of respiratory infection in poultry. The second broad spectrum antibiotics is oxytetracycline. This oxytetracycline is also very effective for control of respiratory disease, enteritis, and septicemia. And the brand name or the name that you can get from the store is Oxycare, Alamycin, Oxytet, and many others. And it's a kind of drug that can be used either in feed or in water, and is widely used for multiple infections, most especially when you don't have idea of the kind of disease or bacteria that is affecting your birds. Then the third broad spectrum antibiotics is enrofloxacin. This is one medication or one broad spectrum antibiotics that I used often, and especially when I carry young birds or day-old chicks, as the name implies. I always use this enrofloxacin as a startup broad spectrum antibiotics for my chicks, and it has never disappointed me. So it helps to control E. coli, Salmonella, and Pastorella. These are mostly diseases that affect your day-old chicks. So you should use this. You can use this and your birds will do very well. An example of this brand name are the Betril, the Enrocozine, and some others. So it's very powerful fluoroquinolone, and it is used in water. It's just to use it in water for like 3 to 5 days. The fourth one is amoxicillin. Mind you, these are the active ingredients. Amoxicillin is also very effective for control of E. coli, Salmonella, Staphylococcus, and Streptococcus. So they are very, very effective, and the some of the brand name are Amoxivet and Amovet and some others. And it is mild and safe, and it's also good for the gut and systemic infections. Then there is another drug that is called that has an active ingredient that is called doxycycline. You see, this doxycycline is also very effective for control of respiratory disease, that is CROD, chronic respiratory disease, and mycoplasma. It's also good for control of E. coli. For example, you have the Doxymed or the Doxyrel. These are brand name I'm calling, and is very good for respiratory disease and intestinal disease. So you can see that these drugs is very, very effective. Then there is another drug that is also very effective. This is not I would not call it a kind of is not an antibiotic per se, or it's a kind of protozoa, and this is sulfaquinoxaline and trimethoprim. These are very effective active ingredients for coccidiosis and bacteria. You see, it's a combination of coccidiosis and bacteria. So sometimes there are some bacterial infections that will lead to gut infection, which will now cause bleeding, and it will make your birds to excrete blood. So this is the best drugs for them when you are not sure if it's just coccidiosis, or maybe you are treating coccidiosis over and over and you are not seeing result. You can then try this sulfaquinoxaline and trimethoprim. It's very effective. It's a kind of sulfur drugs and a trimazine combination. Like I said earlier, it is a combination of anticoccidia and antibacterial drug, so it is very effective to use. Then another broad spectrum antibiotics that is very effective is flufenicol. You see, this flufenicol, though I haven't used it, but I believe it's like somebody prescribed it for somebody, and he used it, and he testified that it's very, very good because it helps to control CROD, Salmonella, and Pasteurella. You can also use it for your day-old chicks as well. It's very effective. Then and it's good for respiratory and intestinal bacteria. Then I think the last one which I will tell you about is very important and is very common, but you try as much as possible to avoid using them regularly. You just have to alternate them so that you will not your birds will not have drug resistance. But please, before I give you this last tip, kindly help me to grow my channel by subscribing and click the bell icon so that you get notified anytime I upload a new video. Don't forget to give this video a like, comment, and share for others to benefit. The last broad spectrum antibiotics that I want to talk about is gentamicin. And this gentamicin, we have that of oral and we have that of injectable. But I want to talk about the injectable. Is good for severe systemic infection. An example is the Gentavet. The injectable, it is used in individual bird treatment and is done by injection. So when you administer this gentamicin to your birds, it's a kind of broad spectrum antibiotics that it works both for respiratory, intestinal, or what have you. It's a very strong antibiotics. I want to go to the examples of how you can use it in cases of an outbreak. So now I want to discuss about some diseases and what should come to your mind, or the drugs that should come to your mind once you see any of these diseases. For example, once you see CROD or mycoplasma, the drugs of choice or the antibiotics of choice that you should go for is tylosin, doxycycline, or flufenicol. Then when you when E. coli comes to your mind, which is the colibacillosis, make sure you go for any of the amoxicillin, enrofloxacin, or oxytetracycline. Then when you have a kind of fowl cholera, which is the pastorella, then go for enrofloxacin or flufenicol. Then if you have mixed infection, you don't know what to do, you don't know the disease, you don't know the symptoms, you don't understand the disease, that is a mixed infection, then go for a combination of tylosin and doxycycline. This is very, very effective. Then the last point also is, once there is bloody diarrhea with bacteria and coccidia, then just go for sulfaquinoxaline and trimethoprim. These are very important drugs that you should know. Now, I want to give you an important guideline on the use of all these drugs that I have mentioned. 1. Always complete full dosage, and in most cases the dosage for this medication are usually 3 to 5 days. Make sure you administer it for this period. When they say 3 to 5 days, the minimum is 3 days and the maximum is 5 days. Observe withdrawal period. When they say observe withdrawal period means the period after medication. That is the only time that the carcass or the eggs, the product of that bird can be consumed. And it's usually between 5 to 14 days, and it varies. It depends on the drugs. Then the third point is that you should provide multivitamins after antibiotic treatment for recovery. This is very, very important. A lot of people will just give plain water and that is all. Try as much as possible to provide multivitamins immediately after any antibiotics treatment, and this aid quick recovery. Then avoid using antibiotics during vaccination unless it is necessary to avoid vaccine failure or drug failure. This is very important. Then the fifth point is that only use antibiotics when signs point to bacterial infection, not for viruses or stress. Sometimes a lot of farmers, once their birds are stressed, instead of trying to reduce the stress, they will administer antibiotics. When they are not sure that it is bacterial or viral infection, they will give antibiotics. So please be very sure of the disease or the type of infection that your birds are prone to before you administer bacteria. If you don't have any idea, consult your vet. I believe you've gotten tangible information from this video. Kindly help me to grow my channel by clicking the subscribe button, turn on the bell icon, give this video a like, and share for others to benefit. Thanks and God bless.